Heavy periods or excessive menstrual bleeding occurs due to many physiological and pathological causes. Many factors such as hormonal imbalance, mental state, diet, and lifestyle contribute to these menstrual problems. Menorrhagia is the technical term for prolonged uterine bleeding. In Ayurvedic texts, it is named as Raktpradar or Ashrikdar, where Ashrik means blood and Dar means excessive flow. Causative factors of heavy periods or menorrhagia. Excessive fasting or fasting for a very long period of time causes an increase of Vat and Pitta doshas. The same two doshas are related to menorrhagia. Excess of sexual indulgence leads to Vat dosh increase. Intake of spicy food leads to Pitta dosh increase. Intake of food containing deep penetrative nature like garlic, asafoetida, mustard, etc. Heavy physical exercise, stress, tension, anger, etc. Origin of menorrhagia. Due to this unwholesome diet and habits, both pitta dosh and blood tissue are vitiated. It leads to heavy periods, fatigue, back pain, etc. Symptoms of menorrhagia. It can be divided into 4 sets based on the vitiated dosh. In Vataj menorrhagia, pain and frothy bleeding is found. In Pittaj menorrhagia, the bleeding will be blackish red, warm and associated with fever. In Kaphaj menorrhagia, pallor, slimy, thick and long-lasting bleeding is found. In Tridoshaj menorrhagia, mixed symptoms of all the 3 doshas are found, associated with syncope and fever. It is very difficult to treat. Treatment of menorrhagia. To balance down pitta dosh and blood tissue, stambhan or blocking therapy is adopted. Line of treatment of Rakt Pitta or bleeding disorder is found to be suitable in menorrhagia. Cooling treatment and medicines, coolant food and beverages are recommended. To arrest bleeding, the medicines with astringent property are well advised. Herbs for menorrhagia. Draksh or raisins or Vitis vinifera, Padmakesar or stamen of lotus or Nilambo nucifera, Chandan or sandalwood or Santalum album, Ushir or vetiver or Vetiveria zizanioides, Sariva or Indian sarsaparilla or Hamidesmus indicus, Gokshur or Indian cowhage or Tribulus terrestris, Bala or country mallow or Sida cordifolia, Durva or Bermuda grass or Cynodon dactylon, Lajvanti or touch-me-not plant or Mimosa pudica, Daruharidra or tree turmeric or Berberis aristata, Shalmali or silk cotton tree or Salmelia mulbarica, Lodra or Symplochos bark or Symplochos racemosa, Kutaj or Conasi bark or Holarina antidysentrica, Tatki or fire flame bush or Woodfordia fruticosa, Nagkesar or Indian rose chestnut or Mesua feria, Shatavari or asparagus or Asparagus racemosus, etc. Here are some of the ready-made Ayurvedic formulations for heavy periods mentioned in various Ayurvedic treatises, but it should be taken strictly under medical supervision. Wholesome diet and habits: rice, wheat, ripe ash gourd, snake gourd, raisins, pomegranate, dates, gooseberry, ghee, honey, etc. Unwholesome diet and habits: pungent, sour, and salty foods, alkaline substances like chips, crispy, crunchy junk foods, fish, alcohol, black gram, sesame seed, horse gram, garlic, sour curd, etc. Ayurvedic home remedies: Nakkesar or Masua feria stamens and Oshir or vetiver roots are made into fine powder and administered 3 to 5 grams along with butter and sugar candy. This subsides even severe kind of menorrhagia. Lajvanti or touch-me-not plant is taken and crushed well. This medicated paste is administered along with fresh juice of durva or Bermuda grass to cure the complaint of heavy periods. Regular usage of raisins in the diet helps to balance pith and also to reduce bleeding during periods. Any bleeding disorder makes the patient panic and helpless. That too when patient gets the complaint like menorrhagia for a prolonged period of time. She will be worried, which causes her health to deteriorate further. Hence, consulting your doctor in early stages will help to a great extent. Hope this information brings health in your life. Thank you.